Franklin woke up to the soft morning light. He stretched and rubbed his eyes and slowly sitting up in bed.
Franklin got out of bed and walked to the bathroom. He turned on the tap, ready to start his morning routine. Franklin looked into the mirror and froze. His face was covered with small, unusual warts. He ran to his room and immediately turned on his computer. He searched for clues and soon discovered what it was.
What is HPV?
HPV stands for human papillomavirus.
Is one of the most common viral infections in the world.
These viruses belongs to a group called papillomavirus, and together, they are the main causative agent of HPV infections. Some types cause skin warts, while others can affect the genital area. And now, let's take a look at how HPV spreads. It is most commonly spread through sexual contact, including vaginal, anal, or oral sex. Even if a person has no symptoms, they can still pass the virus. HPV can also transmitted through direct skin-to-skin contact. This means you can get it through close contact with an infected person's skin. In some cases, an infected mother can transmit HPV to her baby during childbirth.
Majority of HPV infections are completely asymptomatic. You won't feel anything, see anything, or notice any changes. Yet, the virus is still present and can be transmitted. Low-risk HPV types can cause genital warts. These are soft, skin-colored, sometimes cauliflower-like bumps that usually appear on the vulva, penis, scrotum, groin, or around the anus. HPV can also appear as common warts on the hands and fingers. Meanwhile, HPV in the throat may cause a chronic sore throat, difficulty swallowing, ear pain, or a voice that stays hoarse for weeks. However, the more serious concern is high-risk HPV, which doesn't show obvious symptoms. Instead, it silently causes precancerous changes in the cervix, anus, penis, or throat.
A healthcare professional might be able to diagnose HPV infection by looking at the warts. If genital warts don't show, one or more of the following tests can find them. One is the vinegar called acetic acid solution test. It is where a vinegar solution applied to HPV-infected genital areas turns them white, and this may help flat lesions show up. Another is the pap smear. It is where a sample of cells from the cervix or vagina go to a lab to look for changes that can lead to cancer. A pap smear alone does not diagnose HPV, but an HPV test can confirm a positive result. The easiest way to prevent HPV or human papillomavirus are to use condoms and to practice safe sex. In addition, the Gardasil 9 vaccine is available for the prevention of genital warts and cancers caused by the HPV. The vaccine can protect against 9 types of HPV known to be associated with either cancer or genital warts. To prevent health problems associated with HPV, be sure to get regular health checkups, screenings, and pap smears.
Managing HPV is actually simpler than the most people think. For many people, the virus clears on its own because the immune system naturally fights it off within a year or two. That's why one of the most important part of management is regular checkups. Pap smear and HPV tests help your healthcare provider monitor any changes before they become a problem. If abnormal cells do appear, they can be treated safely with procedures like freezing, laser treatment, or LEEP. These treatments don't remove the virus itself, but they do prevent the changes it can cause from the progressing. Genital warts can also be managed using creams, freezing, or small procedures, and regular follow-ups help keep everything under control. Keeping your immune system strong plays a big role too. Eating well, getting enough sleep, avoiding stress, and not smoking all help your body clear HPV faster. And one of the best protection you can have is the HPV vaccine. It guards against the type of HPV most likely to cause cancer and warts. Practicing safe sex, using condoms, limiting partners, and staying consistent with the checkups all help lower the risk of spreading or getting HPV. With proper monitoring, healthy habits, and vaccine, HPV is very manageable and most people do extremely well.
He rushed to the doctor to seek immediate medical assistance and treatment after noticing the sudden changes in his condition. The doctor examined him thoroughly and prescribed the necessary medications to help manage and treat his condition. He began sleeping at the right time and eating healthy foods as part of his daily routine to support his recovery. He later underwent laser removal to eliminate the warts and restore the joint smoothness of his skin. After months of consistent medication and care, he finally became completely free from warts.